We talked about acid reflux briefly. Another one that's prescribed a lot of prescription drugs for. What should people look for? Obviously, it can be dangerous over the long term if not treated, but what should people look for, and what can they do that's maybe a natural alternative?
Yeah, so gastroesophageal reflux disease, or heartburn. I'll send you to, and we did a series of videos at the University of Wisconsin, in addition to some patient education sheets about GERD. University of Wisconsin, Department of Family Medicine. On the right side of the page, integrative medicine, you go in there and you can read all about GERD. But there are lifestyle factors that make a huge difference. So your weight, how tight your clothes are, no
Really?
joke. Yeah, so really, really tight pants, belt that's too tight, tight shirts, tight pants that perhaps are in style, puts a lot of pressure on the abdominal cavity and can cause, actual, reflux and more acid to go north. The other would be drinking a lot of fluids with meals. Stretches the stomach and can open up the gap between the stomach and the esophagus and cause more acid to go north. Certain foods that you eat, citrus, peppermint, chocolate, some coffees, red wine, these things all relax the opening of the stomach and let more acid go up. So, weight, foods that you eat, so thinking about some of those exacerbating factors. And then, I'll think about treatments, and a variety of treatments are necessary. If this is severe or long-standing heartburn, it needs to be checked into, because otherwise you could be at risk for developing Barrett's esophagus, which is a change in the way that the skin is on the inside of the esophagus that is precancerous. So you need to talk to your provider about this for severe or long-standing heartburn. But then there are some herbals that I think about, which would be demulcent or coating herbs like slippery elm, root bark powder, marshmallow. Chamomile even works well to kind of soothe the gastrointestinal tract, and especially the esophagus and stomach. And then deglycyrrhizated licorice, or DGL, are chewable capsules that can help sort of decrease the inflammation of that area and relieve symptoms. So, GERD, I think, is a good example, again, of lifestyle mixed with diet, mixed with some integrative therapies that can create a cohesive treatment plan.